Hey there, it's Dr. Jim. Thanks for stopping by and watching my video. I have a really good topic, one maybe you have not heard of, anosognosia. So, this video is called, What is Anosognosia and what does it have to do with dementia? Interesting. There are several psychiatric and neurodegenerative conditions in which individuals lack an awareness or insight that they have an illness. These people may be unable to identify their own condition accurately or understand the true extent of it. This can lead to a lot of negative outcomes, including insisting that they're not sick at all, refusing treatment and medication, being hospitalized or rehospitalized, aggressive behavior, early mortality, and even suicide. So this is a very serious topic. It's something that we have to take a look at. Now, these outcomes are seen in people who are diagnosed with psychiatric conditions as well, like schizophrenia and bipolar disorder. And we do see it very often in neurodegenerative diseases like Alzheimer's and other dementias. Anosognosia is in fact a rather common but often underrated symptom in dementia. So after watching this video, or perhaps you're going to read the article, you'll see how important it is and how it can impact a person's quality of living. Anosognosia is a neurological condition that impacts both individuals diagnosed with dementia and their caregivers. Some experts refer to it as a disorder of consciousness or a loss of self-awareness. It's been estimated that up to 80% of people diagnosed with Alzheimer's disease are affected by anosognosia. Isn't that interesting? Here's a little bit of a history. We've known about it for a while. Anosognosia was first described by Joseph Babinski in 1914, way back when. And he described it as a state of unawareness or impaired insight in the person's deficits that are associated with dementia. In other words, most people with dementia don't know they have certain problems like poor memory, reasoning, or the need to take medication. And sometimes they refuse. They may believe that they could carry on daily life as usual with no assistance, no help from anyone. So what causes anosognosia? According to research and medical studies, it's the result of damage to the frontal lobes, and this is the region of the brain responsible for planning, organizing, self-monitoring, and controlling one's responses. This part of the brain is also responsible for a person's ability to organize new information and update one's self-perceptions. This means that most people with dementia don't see themselves as having dementia. The condition isn't all or nothing. Some people only partially lose their ability to self-reflect, and sometimes the condition actually comes and goes. One thing is for sure, anosognosia worsens as the disease progresses. Now, I scanned the literature, went through lots of medical journals and articles, and these are the most common symptoms that I found. Individuals experiencing anosognosia will show the following symptoms: impaired awareness or lack of understanding of their condition, denial or downplaying their illness, fluctuation in levels of awareness. At times they will acknowledge their condition and at times they won't. Expressions of anger and frustration towards people who are aware of their illness, and refusal of treatments and medications. Now, can it be treated? Here is a very interesting part of the video. Most experts agree that anosognosia is difficult to treat due to the damage in the brain and the progression of the disease. Keeping the person safe and monitoring their progression is important, okay? Since some refuse treatment and medication, they may actually decline faster, experience earlier death, or attempt suicide. So this is really important. Some individuals will become involved in dangerous behavior, such as taking unusual risks or self-medicating with various substances. Some work has been done using vestibular stimulation, which involves attaching electrodes to the skull behind each ear, or using a vestibular implant to stimulate the vestibular system, and that is responsible for enhanced cognition and balance. Some experts report that cognitive therapy can be helpful, but in the earlier stages, before the illness becomes too advanced. Therapy could focus on trying to understand and accept one's diagnosis and ways to better manage, cope, and lead a better quality life. Another approach involves a form of treatment known as motivational enhancement therapy. This is a form of talk therapy like cognitive therapy, but it's designed to focus on the many benefits of changing one's behavior in order to live a good life. My final thoughts. Dementia, schizophrenia, and bipolar disorder, they all share one common neurological condition, anosognosia, or the experience of not understanding that one has a condition and frequently refuses treatment or medication. Anosognosia eventually becomes worse as the illness progresses. While there are some therapies that might benefit the individual, maintaining a balance between safety and quality of life are always recommended. I'm Dr. Jim. Thank you for your time and attention. Keep coming back for more videos. Thank you so much for taking some time to watch the video. I appreciate it. And if you're a licensed healthcare professional who's looking for some great continuing education, we've got it. And we are always working on brand new, fresh content for you. So you can find the link to the website in the description and keep coming back for more information. I hope to see you soon.